Assalamu alaikum, dear fellows, and welcome to the Scholar Studio. And we really appreciate your efforts and your time that you have participated, and you people are working with the Scholar Studio. And we really appreciate your efforts, and that's why we are trying our best to make sure that all our ambassadors reach to the best of their levels, and they can easily become the mentors of the futures. And most of you people might know me. I'm Nadir Akhtar, and I will be working with you people during all these internships. And we will be discussing different topics, different ideas, and a lot of things. So I hope this will be a good time with you people. And yes, I'm expecting a very good time with you people, and a lot of research work, a lot of questions, and all these things. So before moving towards our course, let's discuss first of all. Today, we will discuss research and its importance for USMLE, PLAY, BMRE, MRCP, and simply how research enhance your medical career and exam success. So, first of all, before moving towards the research, before moving towards the titles and discussing all the research and all these things in detail, first of all, let's discuss these things, that why research is important and how it is important for different medical career and exam success and all these things. So today we will be discussing this, and if you have any question, just write it down with yourself, and at the end of this session, we will be answering to each and every question, and we will be resolving all the queries. So first of all, let's introduce you to the research in medical exams. And research is basically a systematic investigation that is aimed to advance the medical knowledge and improve the treatments options and enhance the patient care. So basically, research, or more specifically medical research, it is a very systematic investigation. And through all the research, you people know that the advancement that is present in today's medical field is due to the advancement in research, and the treatments that are improved are all due to the research. And through all these things, we can enhance the patient care, we can enhance our hospitals and all these things with the help of research. So let's discuss that why research matters for medical licensing exams. That if you want to appear in any medical exams, and you want to set abroad or in your own country, you want to secure different and prestigious position in the research, then you do need the research, and you do need research articles and the knowledge of research, and this will enhance your skills. And basically, if you want to apply for residency, and then the research will strengthen your residency application, and at the time research will improve your problem solving skills and clinical reasoning. And then it may also help you to stay updated on the medical advancement. So basically, if you want to stay in this country, in in your homeland, or stay or go for abroad studies, or you want to practice abroad, so basically research knowledge and research will strengthen your residency applications. It will improve the problem solving skills, and it will also improve the clinical reasoning capabilities. That what are the clinical reasoning capabilities, what clinical reasoning capabilities you can utilize for your research, and it will also help you to solve different problems, and to keep you updated on the medical advancement, on all the advancements in the field of medical. So you will be working on all these things. So if we discuss different types of research in the medical field, and for example, in medicine or any medical field, or generally science field. So the first of all is the basic research, and which is also basic called as basic science research, which is based on laboratory, and these studies done at laboratories and laboratory based studies. Then clinical research, which is usually confined and towards the patient based studies. You can, for example, if you are working in a hospital, and there's a patient and you want to study that particular disease or particular patient, so you can do that clinical type of research. Then you can go for different study design in that particular clinical research, and then epidemiological research, which are the population studies. Basically, epidemiological study you might have heard about the a cross-sectional study or population study or prevalence study. So all of these are epidemiological research and it falls into the category of epidemiological research. Then systematic reviews and meta-analyses, which are the review research. You can do quantitative work or qualitative work. So qualitative work usually defines, or systematic reviews usually is the second form of the qualitative work, and the meta-analyses are the quantitative work where you do analyze different things statistically. And then there are certain things that are considered alternative to the research, and we will discuss these things. First of all, is the authority accepting something as true because an expert or authoritative source says so. So it is authority, and if you are a researcher, you will find out the solution to each and every problem on your own. And if you believe in authority, then anyone who above your senior or your expert, any expert who tells you something, you will definitely believe that thing. And then tradition, you all might be aware of the traditions that believing something because it has always been done that way, that someone else has done that way, so you will do that in that particular way. This is called as tradition. Then comes the common sense, which is not very common. Common sense, in which we rely on what everyone knows or what some seems obvious. So that's the common sense, which is alternative to the research and media myths, that are the cultural narratives which are perpetuated by the media and the personal experience. You accept something as true because it happened to you. And for example, let's say just a simple example that you seen a student that or a patient that is present in front of you and gave some particular medication that is supposed to be dangerous for that particular patient, but that patient improved, and then you believe this thing is on the basis of the personal experience. Or media says something, just like in COVID time, everything was spread according to the media, and these details were spread through the media that COVID vaccination is very compulsory and you should be vaccinated. So, and the people, a lot of people use common sense to do a lot of things. So these are the alternatives to the research. And if you discuss this in detail, why we are discussing these things, that what are the alternative to the research? For example, if you are a student of a research and you want to excel in research, then you must understand that the what are the alternatives of the research and how you will differentiate between research. So, for example, authority, like we discussed that someone expert claims something, and you accept that thing without any verification or without any own study, without your own research. For example, following a senior doctor advice without questioning. So this is something you are falling in the authority category. But if you are a good researcher, even if you don't ask question to that senior doctors, maybe due to many reasons, this may be due to certain reasons, but you should study that thing, that the professor or the senior or the mentor who told me these things, is it true or false? And the second thing is the tradition, which is adopting some practices because they have always been done this way. So using outdated surgical techniques without evidence, and some sort of technique is used by some senior doctor, and you learn from that senior doctor who was graduated in, let's say, 1970s, and he's still using that particular technique, and you learn that technique. Now instead of working on these things and trying to enhance these skills, or trying to find out the recent up-to-date techniques, you start using that particular techniques, that traditional techniques that had been used by outdated techniques. So this is called tradition, that you at that time you will be following tradition, not a researcher. And any researcher who use these things will not be considered as researcher. Instead, that person will be considered as a person who value about the traditions and is following the traditional values or traditional things. Then the common sense is what everyone knows is true, and believing that stress causes ulcers without medical proof. So this is something, if a patient can, if there's a patient in front of you, he's in stress and he tells that he has ulcer due to the stress, and you don't have a medical proof, and you believe that thing because that person told you that yeah, these things happen a lot of time, and this is some common sense. And if you are believing such things, you are not a researcher, you are just following the common sense. And the media makes that miracle cures promoted on social medias, that misinformation that is spread by the sensational headlines that someone drink water from that particular pond and he was ill and he was cured, or there is someone when he touched you or he gave you some type of medications, so that can might be cure of. Even I have personally seen people giving medication for cancers and all these things. And so this is the media myths and the common sense, and these things not work every time. Yeah, this might work sometime, but only sometime. And then the personal experience, that is our generalizing from individual cases. And for example, assuming a patient recovery proves a treatment efficacy, so it's not true. If you have introduced a new treatment and it's the first patient that had been recovered through that particular treatment, and you assume that this is very good treatment for each and everyone, so this will be the personal experience, and that time you will not be working as a researcher, but you will be relying on the personal experience. So what is the difference between research and common knowledge? So basically, research is a systematic, organized, and question-driven, and common knowledge is unsystematic and often biased, and without a clear question, research lacks purpose. So the basic of explaining these things to you people is that you people must be aware about the common sense or the common knowledge or the research or the alternatives of the research. Yeah, so you must be aware of all these facts, and you must know these facts, because a good researcher is that person who knows about their mistakes as well as their capabilities. So it is very compulsory to know about your mistake as well, not just your capabilities, but you have to work on your mistakes and do get info about the mistakes as well. And then why research is essential for medical student? A lot of people may ask you this question, that why research is important for or essential for a medical student and doctors. So there are a lot of reasons for this particular questions and this particular things. So you can give a lot of answers to that particular question. That if someone asks me that why research is essential for medical student or even university student or anyone that is in the field of academia, even honestly speaking, I can talk for hours that why research is essential, why research is important. But let's assume that you people being the investors of the Scholar Studio, you people do know about the research details, and you do have some information about the research. So I'll just short it that research will enhance your medical knowledge. And if you are a good researcher and you are updated about and you are up to date about the particular studies and the latest findings, it will keeps professional updated with the latest findings. So if you are a researcher and you are actively studying different research articles, you are actively participating in the research, then it will enhance your medical knowledge. It will keep you up to date about the new trends, new medications, new techniques, new procedures, and new researches in the medical field or in any field in which you are working on research. And then the next thing is that it boosts academic and clinical careers, and many high-ranking medical professionals have a strong research background. If you look at any doctor in the developed nations, let's say USA or some other country with UK or any other European country, you will see that the medical doctors of that particular country, if you look at their CVs or at their profiles, they will be well expert, and they will be well trained, and definitely the research will boost your academic and clinical career. So if you wish to be able to achieve high ranking in your medical profession, and or if you are interested in studies outside the country, and you want to participate in some test in outside the country, like the foreign tests which are with different names, and you can appear in different tests, USMLE, PLEB, and all these things which we will be discussing next. So it will help you in that thing, and you can easily get matched with this with the help of research articles. And if you do have research skills, you do know about the research, that will provide you the respect and honor. And the research also develops the critical thinking, and the research will helps the doctor to evaluate the validity of study and implement evidence-based medicine. So if you are a researcher and you are working on some new drugs or some new therapy and or any other thing related to the medical field, and you have researched that thing and your results are clear that this thing is very good for or beneficial, then you can use that particular thing or that particular medicines or supplements as an evidence-based medicine, and it also improve that diagnostic and treatment approach. So if you look at if you studies the this month's research articles related to the medical field, you will know that there are a lot of new details arised in the medical field. There are a lot of new findings, new decision makings, and patient care things, and there are a lot of new researchers that are working on some new ideas, new drugs, and new things. So if you are up to date about the research, you will be able to make a decision that will help the patient and that will improve the patient care. Mhm. So we discussed that research enhance the uh, medical knowledge, and it keep you the professional updated about on breakthroughs. For example, CRISPR gene editing, some of you might know about this thing. And for example, understanding messenger RNA vaccine mechanism improve patient counseling. If you are using a messenger RNA vaccine and you're using it for some particular disease, and then you study about that thing, that how the messenger RNA vaccine work, and you explain this thing to the patient that is in front of you, that this is messenger RNA vaccine, and this is the whole process that how this vaccine will work. So it will help you to console the patient easily or to work on the patient details easily. And then publication will yes, if you are working in research field, you will have a different publication and you will be able to publish different articles. So it will definitely strengthen your CV for residency application like USMLE, PLEB, and definitely a case report or a review article or regional article, and any publication in different journals can help you, and it can elevate your profile, and it will teach you that critical thinking, the way of the critical thinking, that research will develop the evaluation of study validation. Let's suppose you are RCT, randomized control trials versus observational studies, and for example, you are identifying bias in a drug trial funded by its manufacturer, and then you have to work on any of these things, and then it also improves the patient care if you give the uh, evidence-based medicine and you are up to date about your medical field. Let's say that they're using WHO guidelines for diabetes management. It can help you with these things. And the role of research in residency and job application. In the US, we will discuss these things. For USMLE, it will improve our chances of securing competitive residencies, and in the UK for PLEB, while not a requirement, research experience enhance NHS job application, and in Gulf countries, some residency program in the Middle East prioritize research background, and then globally, a pharmacy or any other program, a research can lead you to academic and consultancy role worldwide. So first of all, we will discuss about research and the USMLE, United States Medical Licensing Exam, which is shortly called as USMLE. And it is very important. Strong research background can be deciding factor in the residency match, especially for international medical graduates, IMGs. And what are the most value type of research for USMLE candidates? Clinical trials or any type of original article, case reports or any type of original article, and then systematic reviews, meta-analysis. So these things will help you in your USMLE. And specialties, there are different specialties. You might be interested in dermatology, neuro, cardio, onco, or internal medicine. And with the research, you can easily get matched with the help of research publication, that you have a well published research articles, you have done work from the very initial, and you know about the research. And then how to get involved in research for USMLE, that you have to reach out to professors and researchers in the medical school and join the research internship program in the US and even in your own country, just like this program. if someone is interested in USMLE and want to settle in US after this 5 years of MBBS graduation, then he or she can start work from now and learn research now and then start work on the research. And yes, we will be publishing articles and you will have opportunity to learn research. So you people are in good hands, and definitely that's something very great that you people are learning all these things free of cost. And you should utilize these things and you should try to publish and work on more and more research, work on more and more articles. So you have to work on these things and make sure that you do know about the research and you do have expertise about the research and you do have research publication. That's very important for USMLE or any other exams. Then Research and Play, which is Professional and Linguistic Assessment Board UK, is no, research is not mandatory for play, but it enhances the application for National Health Services positions and NHS positions, and how research benefits the UK medical students in their career. So definitely research will strengthen CV for applying for to foundation year and the specialty training, and it will increase the chances of selection for clinical attachments. And it's the same thing. You can join research teams at teaching hospital in the UK if you are in the UK, and if you are not in the UK, if you are in your own country, then I will repeat it again. You have to join different research internships, research organizations, and definitely that experience that you have worked as an ambassador or as a mentor with some research organization, that will also help you in your CV, that will also strengthen your CV, and these things will make sure that you do get the proper job you required for your in your studies. And then let's discuss about the research and the EMRE, which is Emirates Medical Residency Entrance Exam, UAE, and why research is important for EMRE candidates. Some UAE residency programs require research experience, and the research exposure will increase the chance of getting into the competitive specialties. And again, how to gain the research experience? If you are in UAE, you have to collaborate with different local medical universities and different research institutes or different professors. And if you're not in that particular case, then you can work with us. You can work with some other organization. You can work with anyone who is interested and who is involved in the research. And these things will help you to develop your research, to make sure that you have done a good work and you learn about the research. And you can work on retrospective studies, case series, original articles, meta-analysis, and type of research you can work on. So this all things will help you with these the details. And then the research and MRCP, which is the membership of the Royal College of Physicians, UK, and globally, if you will look at this matter, the role of research in MRCP is that MRCP candidates have to pursue research to qualify for higher academic positions, and definitely review publishing in peer-reviewed journals will improve your credibility, and research skills helps in completing MRCP passes and written exams. And then research improvement for MRCP success. You can conduct audits and quality improvement projects and participate in medical research conferences and seminars and different programs, mentors. You can have a mentor of your own research skills, and then you can learn research from mentors or anyone who is teaching you research. So these things will help you during their graduations. And even these research things that you people are learning today, that MRCP and USMLE and all these things that we are discussing today, there might be members of medical field with us who will be the first year MBBS graduate students. So the first year MBBS or BDS students might not get these things right now, but with time and even after the graduation, they will know about these details, and they will be able to be more advanced in that thing, and they will know that the basic aim of these things, and they will know how to get this different countries residencies and how to move towards some other country. So you have to participate in medical research, and researching something that you have to work actively. You can't work on one day and then skip research for next 15 days. So you have to work continuously, even it's less, even it's small, but still you have to work continuously. And let's discuss the types of research that medical students and doctors can do. You can do clinical studies, the direct study involving patient data and clinical trials. Then the basic science research is laboratory-based experiment to understand the disease, the epidemiological research, which is related to the public health and disease pattern, and the systematic review and meta-analyses, which are used to analyze existing study to provide strong evidence, and both qualitative and quantitative study can be done in these parameters, systematic review and meta-analysis using the specified PRISMA flowchart. And then the case report and case series, which are basically the you if you are a medical doctor or MO or HO or even a TMO or a professor or anyone who is working in the hospital, or even just internally. So you see a case of some disease or some particular disease, and you report that case and you start following that case because that was unique. So you can even work on a single patient and publish your article in well-reputed journals by working on single patient. And that is called case reports and case series, which we will be teaching you all these things. Right now, we are teaching you the basic science research, the clinical research, the epidemiological research. Then we will move towards the case reports, case series, and then systematic reviews and meta-analysis. So we will provide you everything that we know, or will do help you in each and every aspect, because our aim is to make sure that the ambassadors we have should be mentors of tomorrow, and they should learn the research by their own, and they should be capable of doing the research by their own. So these are the types of let's discuss these things, that how a medical students and doctor can do, what type of research they can do. So clinical trials, if you want to test new drugs, if you want to test different therapies, then you can do clinical trials. For example, phase 3 trials for cancer drugs, and then case reports. Case report is documented is rare condition, for example, a 12-year-old with triple leg syndrome or some other disease. So this is a rare that particular case report is the some condition that is rare and not normally present in the general population. And then systematic reviews, for example, you want to analyze the existing studies, that efficacy of telemedicine in rural areas or something like that, then you can work on that systematic reviews. And then there are epidemiological studies that track disease patterns, that, for example, rising, if you want to work on diabetes in Pakistan, then you can study that the rising diabetes rates in urban Pakistan, and you can work on that thing. So these are the different example of these things, and you can work on any of these. And then let's discuss the benefit of research for career growth. If you are a good researcher, the research will enhance your residency and fellowship applications. It will help you and demonstrate that you have analytical skills and you have commitment to the medicine, and you already have worked on some particular research ideas. You have published original research articles and systematic reports, meta-analyses and case reports, and a lot of things. So it will enhance the residency and the fellowship applications, and it will improve the patient care. It will enable the doctors to apply the latest medical advancements, and it will develop the leadership and the teaching skills. If you are a good researcher, you can move easily to the academic position or academia. You can easily work on the academia, and then you can expand the professional network. There are opportunities to collaborate with the top medical experts and in the medical field. For example, if you are working on any particular art field, if you are interested in in epidemiology and you have worked on that particular field, then you can present your article in different research conferences, and you can participate in different research conferences and present your article or your abstract over there. And then after presenting these things, that after presenting the article, you will be able to collaborate or to work with different professionals, and a lot of new researchers will be there, and you will be able to collaborate with them. And and who knows, that you might start work on another projects with the collaborators or the researchers who was there in the research conference. So yes, you can get expansions, and you can expand your professional network by working on the research. And then there are steps to get involved in the medical research. And what are these steps? Let's discuss this thing. The step one is to identify the research interest. You have to make sure that in which topic you are more interested, in which topic you want to perform more, and in which things you want to work easily, and you can easily work in that particular field. So you have to make sure these things, and the step two is to, first of all, you have to make sure that to choose the topics that are based on your specialty and career goals. You can't work in without any goals in research. So you do have a, and you must have a specific goal and specific research field in which you want to excel. You can do research that one day you work in cardiology field, and on the another day you shift yourself to dermatology, and on the third day you work on some research related to epidemiology and prevalence and all these things. So you have to make sure that you choose the topics that is based on your specialty and the career goals, and then you have to find the mentor, which is the second step. And you can approach faculty members and researchers in your institution if they are not free and then not willing to help you. And there might be mentors available. There will be organizations just like we are providing these things, and we are do providing free research courses. And usually, a lot of people contact us for mentorship, and them sometimes they just ask few questions. When we do answer all of these questions, we do try to answer each of the questions. So these things will help you to involve in the research, and this thing will keep you up to date about the research. For example, in this research internship that we are working on, you people will be able to learn about the research, and then you will be updated about the research that what you want to do in the future. Then you have to find the mentor, and then research groups, join the different research groups and conferences. You can participate in medical research organization. You can work on different public private research organization. You can work on different things, and then conduct the research and collect the data. You have to start work and collect the data, and conduct the research, engage in clinical or lab-based studies, and then the step five is to publish and present your work. You have to submit to medical journals and conferences. You can submit your articles, your research to that particular journals and conferences, and then you can easily present them. And this cycle, this loop will continue, and you will meet another researcher. Then you might decide another topic. Then you might start work on another topic. So these things will help you. First of all, you have to mentor. For mentorship, you can approach your professors or senior doctors with you aligned interests related to you, and then you can also take small starts and join ongoing projects. Data you can, for example, there is a project work, and you can just collect the data. Even if you are able to collect just the data, you can do that thing, and that will help you. And this small contribution will teach you a lot of things, and with the help with the time and with the help of these small contributions, you will be able to work on major research projects one day. And then you can also publish the case reports, and for that particular case reports, you can use data documents unique cases during the rotation. If you are working in, if you are on your job and in your rotation duties, you can document different unique cases and follow them and work on them and then publish them. And you can also attend different conferences, present the posters. For example, there is a CPSP annual conference, and nowadays different medical college and different medical institutes and universities are working on different research projects, and they do announce different research annual conferences. So you can work in that conference. You can participate in that conferences, and you can use free the tools. For example, you can use Zotero for reference management, or EndNote for reference management, and Google Scholar for literature search. So you can do these things, and this will help you to enhance your research skills, to work on your research skill in a better way. And then there are some common challenges in research and how to overcome them. First thing is the lack of time, which is the major issue. In this world, no one has time, and you have to manage the workload by setting research goals and timeline. If you ask any of even your supervisor, they will be facing that thing. But you have to manage your workload. If there is a lot of work you have to do, then you have to divide the work, that what work should be done first, and then second, and then third, and so on. So then, finding a research mentor, you can reach out to professor and attend research workshops, and just like we discussed, that you can participate in different workshops, different free seminars, and understanding the research methodology. For research, you have to understand the research methodology, and for that purpose, you can take online courses or attend a research training, and then publication of the articles. You can You can start with the case reports or collaborations with experienced researcher, and with the time you will learn new things about the publication. So the main aim of these things is that research is not something that you can understand in 1 month, or with one course, or with one, or with some little bit study. It is something that you have to work continuously on, and if you do not work continuously, you will not be able to be a good researcher, and a good researcher is the one who works continuously. And then research ethics and best practices, we will discuss these things as well. So first of all is the ethical consideration in the medical research, and you have to obtain an informed consent from patients and follow the guidelines for human and animal research. If you are using humans or animals in your studies, then you have to get the informed consent from them, and you have to avoid the research misconduct and do not do that data fabrication or plagiarism things, and you have to maintain the transparency and honesty in results, and also do the best practice for conducting quality research, use appropriate study designs, and follow the statistical guidelines for data interpretation. So you have to use appropriate study design and follow the statistical guidelines for data interpretations. And then let's discuss this about ethical declaration template. You have to declare that this work is your own, and all are properly cited and non-ethical practice for you. So not just citing, you have to make sure that everything is ethical, and the key ethical these are the key ethical practices, and you have to follow the different parameters for the ethical considerations. And then let's discuss the research and evidence-based medicines. And what is evidence-based medicine? This is a practice of making clinical decisions based on the best available research. There is a research available related about some particular disease, and you practice that thing on your patients in your hospital or somewhere else. So this is the clinical decision that is based on the best available research, and how research contributes to the EBM. And for example, it provides reliable data for guidelines and treatment protocol, and you can use antibiotic stewardship programs and new treatment guidelines for chronic disease. And example of these are the example of research influencing medical practice. And what is the EBM? Basically, EBM is integrates the clinical expertise, patient values, and the best research evidence into decision making. And how research supports the evidence-based medicine, or EBM. Guidelines examples: the CDC antibiotic steroid protocol based on the meta-analysis, the treatment protocol using dexamethasone for severe COVID-19 after recovery trial findings, and then the diagnostics tool, for example, adopting AI-driven imaging tools validated by peer-reviewed studies. So these are the diagnostics tools and the things that will help you in your research. And what is the future of medical research and AI in healthcare? So what is the role of the artificial intelligence in medical field? You all know, if you all people are aware about the AI and the artificial intelligence in different fields, and with the same intensity, it is also making its path, its way in the medical field. So AI powered diagnostic and predictive models are present, and the emerging research fields in the medicine is the genomic medicines and the personalized treatments and the telemedicine advancements. And then how medical students can prepare for the future research. You have to learn bioinformatics, data analysis, get involved in AI-driven healthcare projects. If you want to work on the AI side of the medical research, then you must learn the bioinformatics, data analysis, and get involved in the AI-driven health projects, and then you will be able to work on the interlink or interdisciplinary field of medicine and or medical and AI. So the future of medical research and AI in healthcare is that different AI algorithms can easily detect tumors in radiology image, for example, Google's DeepMind and some other softwares, and it detects the different details in more or less time than the common humans way. And there are also predictive models that are forecast disease outbreaks using big data, for example, COVID-19 spread modeling. In the emerging field, genome medicine, that is tailoring treatment based on the DNA, and CAR T cell therapy is one of the important thing is this in this field. And then the telemedicine, that remote patient monitoring via wearable devices. You can even monitor some patient through telemedicines. And career tip is that if you want to excel in AI and medical field, you have to learn the Python, which is a computer language, and R, which is also a language, data analysis software for data analysis to stay competitive. So you have to work on these things, and if you want to be a good researcher. And then is the conclusion and final thoughts. Research basically plays a vital role in medical education and career development, and a strong research experience boost application for USMLE, PLAY, BMRE, and MRCP. And engaging in research enhance the clinical decision making and evidence-based practice. And the main point of today's lecture was to take action. Start small, find a mentor, and contribute to the medical achievement. So you people have just taken few steps, and you are just on the brink of the contribution to the medical advancements. And we will make sure that this happens, and you do contribute to the medical field. So and now this was the first lecture about the research and the importance of research. So if you have any question, we will be answering to all of your questions. And if you have any question, we will be answering to that particular questions. But so that was all about the today's topic. And now you can even send your question in chat or directly ask